Today, we are going to be talking about oxygen therapy, specifically oxygen under pressure. Jason Saunders wrote this book. He runs HBOT USA. We're going to talk about, and for those of you wondering why I'm looking off screen, I'm on Instagram and I'm on YouTube and Facebook right now. And I'm going to be covering this book. This is the new Dr. Stillman book club. A couple weeks ago, we did the first one, which was Testosterone for Life. As always, for consultations, stillmanmd.com. Apply for consultation, top right-hand corner. And what we're going to be talking about tonight is the amazing benefits of oxygen therapy. Jason's actually going to be on the Instagram Live later at about 8 o'clock. For now, we're going to jump right into oxygen therapy. So the thing about this book that I like is that Jason starts with an anecdote of his own. In 2006, he herniated a disc in his lower back and was incapacitated for a few weeks. And he was pain-free and back to work within a couple weeks, but he had significant nerve damage. He's a chiropractor. His wife's a chiropractor, so he had a lot of adjustments during that time. Then he went to a conference, tried some hyperbaric oxygen therapy, and he writes, when I left the conference that weekend, I had regained about 20% function in my foot and had learned enough about hyperbaric medicine to want more. He then goes on to buy a hyperbaric chamber and sees his back pain and nerve pain resolve completely. One of the big deals in medicine, as you probably realize, is back surgery and low back pain. Lots and lots and lots and lots of people have low back pain, and lots of them go for low back pain surgery. The tragedy of this is when you actually do randomized controlled trials of back surgery, they fail dismally. On the list of books I'm going to address in this book club is I think it's called Back Surgery, Surgery, the Ultimate Placebo. It's about how surgical outcomes are largely based on the placebo effect. As unbelievable as that may seem, it's very well substantiated in the literature. That's not me going way out on a limb there. So the cool thing about something like hyperbaric oxygen therapy is that it supplies more oxygen to the body. Hyperbaric means high pressure, so it pressures more oxygen into the system. And that oxygen then runs around the body and turns on a lot of healing protocols or programs, let's just say. And that's where and why I decided to address this book. I picked it up at Runga in Austin, where I was hanging out with my friends Ben Greenfield, Joe DiStefano, amongst others. And I met Jason there, and I tried the hyperbaric oxygen tanks that he sells through USA HBOT or HBOT USA. I can't remember. Anyway, so I love that he starts with an anecdote. I always like doctors who actually do or got into what they do because of their own experience in healing. The first part of this book, after that testimonial, is pretty... it's a lot of detailed physiology, disease states, epidemiology. It wasn't, for me, it was a lot of redundant stuff. If you don't have a background in it, you might want to check it out. But the parts that I really liked beyond that were in chapter 10 on page 81, he starts to get into some of the necessary ingredients, he calls them, for regeneration to occur. And the first one that I want to talk about is stem cells. So the really cool thing about stem cells and oxygen therapy is that when you use certain oxygen-based therapies, things like hyperbaric oxygen, things like ozone, you can stimulate stem cell activity. This can lead to an improved wound healing. It's one of the reasons why I think people are jumping the gun when they go straight to stem cells when they haven't tried something like hyperbaric oxygen. Depending upon the number of dives you're going to do with the hyperbaric oxygen, depending upon the tank you're using and where you're getting it, you could spend a lot more money on the stem cells, which I've seen fail a lot, and not get the same benefit. And the hyperbaric oxygen therapy, for the price of many people's stem cell procedures, you can actually just get your own hyperbaric oxygen tank and do your own dives at home, which is pretty amazing. It's not going to be the kind of dive that you'll get in a professional grade or doctor grade hard shell tank. The other thing I want to talk about really briefly is the how oxygen affects the metabolic state of the cell. So many of you will hear, or you'll hear in the health and wellness info space, about oxidative phosphorylation and glucose metabolism and the Krebs cycle and Otto Warburg, and you'll also hear a lot of things about cellular hypoxia. What I think is really interesting about this space is that when you look at the literature on cellular oxygenation, it's very clear that the cell membrane has to function optimally and have the optimal composition, which means you've got to have the right balance of fatty acids in your diet. That's why I always check fatty acid levels in the red blood cell membrane in my patients multiple times a year or at least once a year, because I want to make sure that they're not making a big mistake in terms of their fatty acid contributions in their diet. Because you'll see a really wide array of levels and you'll see a lot of pathology associated with that. The reason that's important is that the composition of that cell membrane really controls how oxygen diffuses across it. And you've got many different membranes through which the oxygen has to diffuse in order to get to the mitochondria, the cell, for it to be burned for energy. Okay, that's in a book that we're going to be covering later on in the book club, probably in July. We're going to talk about cell membrane composition, omega-6s. Are they good? Are they bad? Fish oil, is it good? Is it bad? Should you be taking it? It's a long story. So anyway, ketosis and ketogenic diets and fasting are really cool in that they can turn on a lot of different cellular programs and they can activate a lot of metabolic machinery that helps the cell repair. I will tell you, frankly, that I don't think they're for everyone. I see some people whose labs, they're not able to fast well for a variety of reasons. And that's something that doesn't get addressed by a lot of practitioners, particularly in books, particularly right now, because keto and intermittent fasting is really all the rage. And I see a lot of people feeling like there's something wrong with them because they can't do it. Some of you are fast metabolizers, and you really are not going to do well if you actually, you're not going to do well if you fast and eat a ketogenic diet, and that's okay. You're not there's nothing wrong with you. You can be fine. Now it can be modified by changing diet, nutrition, lifestyle, things like that. But okay. So let's talk about oxygen. The role oxygen therapy plays in regeneration. Jason writes, I view oxygen as a necessary nutrient because, as defined by the Merriam-Webster dictionary, a nutrient is a substance that provides nourishment essential for growth and the maintenance of life. Oxygen absolutely falls into that category. I completely agree. And then the question becomes, how much oxygen do you want? And this is where hyperbaric oxygen therapy becomes so helpful, right? Because if you can get the dose right, and you can increase the dose, you can get a therapeutic effect. So let's explore a general way to discuss how we ought to view oxygen dosage and necessary usage throughout our lives and the lives of our patients. To do so, I'll compare oxygen to vitamin C. If we have a vitamin C deficiency, there are consequences, specifically the condition scurvy. Of course, we try to get more than the minimum amount of vitamin C to prevent scurvy, but also to have enough of the vitamin to ensure that there is enough for other bodily functions such as skin healing, collagen formation, strong immunity, and more. This would be the optimal range. I will tell you, having measured vitamin C levels in many patients, that when they really hit rock bottom, that's when you start to see scurvy. But these people are very, very sick at suboptimal levels. And this gets into Paul Merrick's work and Pierre Corey's work in the ICU, along with many other collaborators whose names escape me right now, who looked at and have looked at vitamin C and its efficacy in treating patients with critical illness, specifically sepsis. If you look at the biochemical pathways, this combination of thiamine, IV vitamin C, and hydrocortisone in their studies has really improved outcomes in critical care, specifically preventing ICU hospitalization and acute progression to acute kidney injury. But that's a whole other story. That's the kind of protocol I would use in hospitals when they would let me use the vitamin C, which frequently they wouldn't, which of course I hated, but you know how hospitals are. So anyway, there may be times we may need or want to megadose oxygen. That's what hyperbaric oxygen therapy is about. I'll tell you that from my perspective, there's many different things that we can do to manipulate oxygen in the body, but the three most available therapies are high-dose vitamin C, hyperbaric oxygen, and ozone. High-dose vitamin C is not so much a therapy that introduces oxygen into the body, but the vitamin C at a very, very high dose induces an extreme oxidative stress on the body. That goes back to Linus Pauling's work on this in cancer. You can read his book on that. Even though it's dated, it's still very thought-provoking. I've seen patients with cancer who got high-dose vitamin C really consider it very life-enhancing, even if it isn't necessarily life-saving. Unfortunately, it's not as simple as just dumping vitamin C into the system to get a cure. Otherwise, you would have heard about it, at least in some cases. So there's vitamin C, then there's hyperbaric oxygen. Hyperbaric oxygen, they're pushing a higher pressure of oxygen into the bloodstream, so you're getting more oxygen delivery around the body. And then with ozone, typically the blood is taken out of the body. It's ozonated with ozone from a machine, which is drawn off of an oxygen tank, and then it's reinfused into the body. There's a bunch of different ways to do this. There's a bunch of different procedures for treating things like joint pain or back pain. Guys like Rob Rowan and Frank Schallenberger have probably been the two most active doctors teaching this in the United States. They're the kind of people who I'll tell people to get on a plane and go see if I think ozone is the right thing for them. All right. Let's talk more about oxygen and the reasons why it works. The reason we would want to megadose oxygen is because oxygen deficiency or hypoxia can be systemic, like with COPD or emphysema. But even more common is local hypoxia due to trauma, injury, inflammation, or toxicity. In these cases, the body can be completely saturated with oxygen at 96 to 100%, but there can be a specific area within our body due to these factors and microcirculation damage that has less oxygen than 96 to 100% and is therefore in need of an oxygen boost. In that case, it would be a perfect time to absorb extra oxygen if somehow that were possible, and that's what HBOT does. Yes, high-dose vitamin C causes oxidative stress. Because it kicks off the respiratory cascade and the respiratory burst in your white blood cells. And so that creates a lot of free radicals, and that creates a huge stress on pathogens as well as cancer cells. And that's how it can cause those cells to apoptose and how it can kill those pathogens. All right. Next up, let's talk about the adaptation to altitude. Here's why I want to talk about this. People look at oxygen tensions in the body and they learn about high altitude adaptation, and they think that if you can adapt to a high altitude physiology, you'll increase the amount of oxygen that you're delivering to your cells and tissues, and therefore you'll improve your oxidative status. That's true, but HBOT and ozone increase this by many orders of magnitude. It's far more powerful to use ozone or hyperbaric oxygen in order to boost tissue levels of oxygen than it is to practice or acclimate to altitude. Now, that being said, I think that one of the low-hanging fruit that people really are missing out on in general is the benefits of what are altitude training, which more specifically is called hypoxic hypercarbic respiratory training. So hypoxic meaning low oxygen, hypercarbic meaning high CO2 levels. As you get to higher and higher altitudes, oxygen tensions in the atmosphere, well, the oxygen proportion remains the same, but the pressure's dropping, right? So you have less oxygen dissolved in your blood. The body's response to this is to produce more red blood cells. But one of the other things the body will do is it will produce more CO2 in order to shift the hemoglobin oxygen dissociation curve in a favorable direction to cause more oxygen to be offloaded from the hemoglobin. And if that all is just scientific gobbledygook for you, basically what I'm saying is that the body adapts to high altitude by increasing the amount of oxygen that you offload off of your red blood cells into your target tissues. That takes some time. I think people need to wake up to the power of hypoxic hypercarbic respiratory training, which is what that is. That's the Buteyko method. It's things like control pause, body oxygen level test, that kind of stuff. I have everybody do that. I have everybody do it because many people have serious problems with their respiratory mechanics. And even if they don't have serious problems with their respiratory mechanics, they can still see a significant therapeutic, not to mention longevity and fitness benefit from improving their breath work. And I talk about that more specifically and in more detail with patients, giving them exact protocols to follow when they consult with me, which you can do via my website, stillmanmd.com. Apply for consultation in the top right page. All right. Hyperbaric therapy is the only method by which we can absorb a significant amount of oxygen above the 100% saturation of our red blood cells carrying capacity. There you go. It does a pretty amazing and unique thing. And that's why when I have a treatment-resistant case of many different things, depression, anxiety, insomnia, PTSD, someone with a history of head trauma, people who are struggling with chronic pain, chronic infections, anything like that, hyperbaric oxygen therapy is on my list of things to recommend to them. All right. The amount of oxygen surplus we can create inside the body is directly related to the pressure of the chamber, the percentage of oxygen the person is breathing, and the amount of time spent in the chamber. What that means for you guys, practically speaking, is the hyperbaric chambers are not all the same. The very rigid, very strong ones that are available in doctors' offices are not really available for the public because they're too expensive. but they may be the thing that you need in order to get a good result. They're also the kind of thing that your insurance may actually pay for, which is nice. You can, however, buy a smaller tank that's soft and not rigid, therefore, and have it at home for your own use. That's a nice, it's a nice thing to have around. There's several $1,000s at least. You can buy them through Jason, who, as I said, will be on the Instagram Live at 8. And I think if someone's got the space and the money to buy one, it would be really useful. Let me explain why. Frequently, I'll have patients who are patients of mine. They want to avoid, hey, Melly, they want to avoid the hospital at all costs. And they get sick, and we try everything conservative, and then we get to a point where there's nothing really else that we can do. And I feel compelled to tell them to go to urgent care or the hospital and at least get examined. There's a lot of cases, upper respiratory illnesses, sore throats. Those are the two main ones where I can think of hyperbaric oxygen treatment actually being a potential adjective that could keep somebody out of the hospital. We'll see if that plays out. It's the kind of thing that's never been studied before, but I think there's a reasonable hypothesis as far as the possibility that it will be effective. But again, it's a pretty high barrier to entry to purchasing that device. Higher pressure, higher oxygen levels, more absorption. So that's the goal with hyperbaric oxygen therapy is increase the pressure, increase the absorption, increase the oxygen delivery. The more sophisticated the tank you're using, the higher the delivery. All right, next up. The rest of that is mostly scientific stuff. And then Jason goes into a very detailed explanation of respiratory physiology. Now let's talk about HBOT for improving function for a range of conditions. Let me begin this conversation by saying that hyperbaric therapy is instrumental in helping people with an enormously wide range of conditions, but it does not treat disease. I like that he says this. Oxygen is a required nutrient that, when supplied in higher amounts, allows the body to do what the body does, self-heal and self-regulate. So when we help supply the body with the required raw materials for function, the body can take those materials to make cellular energy and heal itself. I want to reiterate that I believe that this process of oxygenation depends not only upon the amount of oxygen in the cell and the respiratory mechanics of the patient. I believe that it also has to do with the membrane composition, and that means that high quality, organic, non-GMO, properly preserved nuts, seeds, meats, all of these sources of fat in your diet, they need to be of the highest quality possible so you have the best possible membrane biochemistry that will allow oxygen to diffuse through your cell membranes. All right. The various benefits of HBOT: increased perfusion, neovascularization, increased white blood cell function, nerve healing, wound healing, stem cell release, vasoconstriction, mitochondrial healing. It's an anti-inflammatory and it's an antimicrobial. Is that enough for you? I hope so. There's not a whole lot of other health benefits that anything can offer you. And that's why Jason says it doesn't treat disease. It's not, going to magically cure syndrome X. Okay. What it's doing is it's giving the body the oxygen that it needs in order to perform the work that is necessary to be done in order to actually heal the body. All right. And we're going to talk about some of the processes of through which oxygen therapy works. So neovascularization. This is a process by which our body heals and rebuilds its capillary network. Much of the local hypoxia seen in certain injuries and other inflammatory reactions is due to a lack of oxygenation. In the early phases of hyperbaric therapy, there is immediately increased perfusion as discussed above, but longer term our body can build new capillaries. This is really important for people who've got vascular issues. That's less the issue for people who are younger, but particularly my patients who are 50s, 60s, 70s, 80s with something like heart disease. So long as we've got their inflammatory levels under control and we're properly nourishing them and controlling all their other risk factors, there is a strong argument to be made for oxygenation helping their bodies to build new red blood vessels into areas of, say, the heart or other areas of the body where there's been a lack of blood flow. And that's, let's say speculative on my part, but I'm hopeful that we'll find research in the future that actually confirms that and it allows us to then treat it. This leads to an ability to continue proper oxygenation of the inflamed or injured area indefinitely after the hyperbaric sessions are complete and the new vasculature allows for normal and continued blood flow. I think this is part of why it works for people with TBI. Those people have had trauma to the blood vessels of the brain, and that scars those down. That reduces blood flow. It increases the amount of fibrous tissue that oxygen has to get through. You increase the oxygen tension, you increase the vascularity, you can improve blood flow to the areas of the brain. You can get somebody a therapeutic result. All right. Increased white blood cell activation. Oxygen is the fuel of our white blood cells. With low oxygen levels, the white blood cells cannot get enough O2 to fuel the fight against pathogens. That means raising blood oxygen concentrations allows oxygen to get into the injured areas, allows the neutrophils and lymphocytes in order to use it. Then they kill all the bad pathogens that are making you sick. This is why people with things like chronic Lyme or fill in the blank chronic infection will go and pursue hyperbaric oxygen therapy, not to mention things like ozone and whatever. A lot of those people have hyperventilation syndrome and need to work on their Buteyko breathing, in my experience, first. Not practicing medicine by the internet, for the record. I think my lawyer wants me to say that in the beginning. But that's just been my experience. A lot of those folks with chronic Lyme disease have got terrible respiratory mechanics. And when I say terrible, it's like in all caps, terrible, atrocious, the worst I've ever seen respiratory mechanics, and it's a big part of their problem. Nerve healing. So nerve pain, if you've ever suffered it, you know how exquisite it is. There are headaches, one called tic douloureux, that's so severe, it's called the suicide headache. People will contemplate or even commit suicide because this neurogenic pain is so bad. Nerve pain is a terrible, terrible scourge on people. And so this is one of the conditions where I start to think about oxygen as a therapy, because it's so important to get these people some relief so they can get on with life and not enter this terrible spiral of worsening overall function, less and less social support, and then gradually, worse and worse quality of life. Someone's asking me a question. Oh man. Can someone who had a TBI and a thalamic bleed benefit from HBOT? You know what? I have no idea. Ali Zales, I have no idea. That's a really technical question. You want to ask the acute stroke doctor who's managing that. All right. So nerve healing relies very heavily on oxygen supply and waste product removal. In many cases of neuropathy or nervous system damage, there are low oxygen levels due to microcirculation damage and high levels of toxicity due to the inability to carry away waste products. The brain makes up only 2% of our body mass, yet uses about 20% of all the oxygen that we get. That means that delivering oxygen at a higher pressure in a higher amount to the brain when it's injured can be instrumental in getting it to work better, or rather recover. Same thing goes for your peripheral nerves or nerves in your spinal cord. Here are some excerpts from some studies that Jason includes. Although nerve traumas are not yet indicated for HbO2 therapy, hyperbaric oxygen, by which they mean they're not insurance reimbursable, we conclude that HbO2 therapy triggers most of the mechanisms required to induce axon regeneration. I think this is part of the future of stroke, TBI, and other peripheral nerve injuries. We conclude that HbO2 therapy HbOT has been demonstrated to have neuroprotective effects without increased oxygen toxicity in experimental TBI models when administered at pressures less than 3 atmospheres. One of the questions with oxidative therapies, and you'll run into this from conventional docs who haven't studied them, is are these therapies going to cause harm to the patient due to the oxidative stress that's associated with them? Oxidative meaning, oxygen oxidizing things, rusting them out, causing oxidative damage. This is one of the sort of paradoxes of oxygen-based therapies. Ozone, hyperbaric oxygen, vitamin C. You're inducing an oxidative stress. Now, the oxidative, let's call it the oxidative theory of aging, is kind of dead now, because the theory basically said that the more oxidative stress you endure, the shorter your life will be. And that the more antioxidants you then take in, the longer you're going to live. That doesn't actually pan out in the real world. Study after study has failed at this. Now, that's in supplement studies. I want to draw a distinction between that and a dietary intervention or change, because one of the things you'll find, at least clinically, is that you can't out-supplement a bad diet. If the patient's not willing to change their actual diet and they take all kinds of supplements, they may get a therapeutic benefit, they may see a small improvement, but they're not really going to get durably and significantly well. And this is one reason why when I consult with patients, which you can apply for at stillandmd.com, I will actually try to get them on a diet of functional foods that addresses all of their deficiencies without them having to resort to supplements. That's not always possible. Sometimes there's too big of a deficit and you have to, or I shouldn't say have to, but it behooves you to actually use a nutrient in a concentrated form like a capsule or a powder in order to make up a lot of lost time or distance. But anyway, the point is hyperbaric oxygen therapy, when done properly and appropriately at the right quantities, doesn't induce oxidative stress in a injurious way. It actually triggers healing and regeneration. But this does imply that if you were to overuse these things, you might run into some negative health effects. This is where we don't have enough data and enough information to really know. All right. Significant improvement was seen in a bunch of patients with a variety of neurological disorders. And what they did in this study was they compared it to SPECT scans before and after. SPECT scans are really cool functional neuroimaging techniques pioneered by a guy named Dan Ammann, who's written most of the books on that. And SPECT scans have mostly been replaced now by PET scans and functional MRI, but the SPECT scanning literature is very clear. You see definite patterns of brain dysfunction in people who've had TBI, who've had strokes, who've got metabolic disorders, who've got some kind of inflammatory issue with their brain. And that allows us to use SPECT scanning in order to understand better the neurobiology of someone's mood disorder, let's say, which is mostly what Dan Ammann does in his clinics. I don't use them for that. I just take a history and then look at labs and then go from there. And so I don't actually recommend that people get SPECT scans. Maybe one day I'll go back to ordering something like that, but I just don't get the clinical benefit. It's sort of more if you're curious about it, we could order it. But what they're saying here really is that if you use hyperbaric oxygen therapy, we've substantiated that it improves the function of the brain through the delivery of oxygen to it. And that's a really important thing, particularly for people who I'm taking care of, who we've tried everything. We've put them on the right, fatty acid mix. We've got them on the right proteins. We have them on the right minerals. We have them doing the light and the sauna and avoiding EMF and all these other good things. All right. Stem cells. As discussed earlier, one of the effects of long-term use of HBOT is stem cell release. Once we reach 20 plus hours of hyperbaric therapy, we begin a process of releasing stem cells from both bone marrow for our musculoskeletal tissues and in our nervous system for healing brain and nerve tissue. What that means is that you have a certain threshold effect here. This is a very important therapeutic concept for patients to understand with any therapy. There's a certain threshold sometimes that has to be reached in order for the therapy to be effective. That's why it's not fair to say, I tried that, it didn't work. Well, how long did you try it for? What was the dose that you were at? Sometimes it takes days, weeks, even months for a therapy to really start to work. Usually this is a drug that's getting to steady state. In this case, it's a matter of time under increased oxygen tensions and pressures, pushing oxygen into the various parts of your body and your cell. Improved mitochondrial function. This is the reason why HBOT is taken off in the biohacking community. The minute something's substantiated to improve mitochondrial function, induce mitophagy, whatever, all of a sudden the whole biohacking world buys one, tries one, and starts Instagramming about it. That's not a dig, it's just a fact. All right. As a result of increased oxygen exposure, the mitochondria increase in efficiency, size, and density. Word to the wise. Looking at things like improving your mitochondrial efficiency, size, inducing mitophagy, all these other things without assessing your nutritional status is a big mistake. It is very common for biohackers to burn out their physiology in key ways through very imbalanced diets, leading to an inability to use the mitochondria they have, let alone make new ones. When you give these people back the right mix of minerals, amino acids, vitamins, you name it, wow, all of a sudden all their biohacking starts to work a lot better. How about that? All right. Insta Fisher asked about the use of Clomid for men or natural alternatives for semi-low. So what Insta Fisher is talking about or asking about is whether or not we should use Clomid to treat low testosterone in men. And I can't answer a question specifically to you, dear sir. If you want a consultation, you can apply at stillandmd.com. But what you're alluding to, and it's funny you're asking me now because I actually just had this book out. This is the last book we did on book club, Testosterone for Life, Abraham Morgenthaler. Clomid is a good option for men of reproductive age who may still want to have more children, and they want to maintain normal sperm production and maturation in their testicles. Clomid is a drug that will fool the body into thinking there's not enough testosterone around. This then turns on testosterone production. For those of you who've never heard me talk about this, again, we did this in a book club 2 weeks ago. You can go watch the replay of that on YouTube or Facebook, which is where those always are. And I'm streaming this right now to Facebook and YouTube, as well as doing it live on Instagram. But anyway, short answer is yes, Clomid can be used for testosterone therapy in young men. But I also want to add to that, anytime you're thinking about replacing a hormone, you should ask questions about why is the hormone low? And you shouldn't stop at, is your sleep okay? Are you eating well enough? This is a very myopic, very shallow understanding of what controls hormones. You need to ask questions like, is your light environment appropriate? What are your stress levels at work? How are your interpersonal relationships? What is your nutritional status? Do you have enough cholesterol, pregnenolone? Do you have some kind of really big imbalance in your hormones? All of these things are relevant for understanding what is going on with a man's testosterone before we just start prescribing this stuff willy-nilly. Okay. As the oxygen levels increase, the electron transport chain ramps up in the mitochondria. Almost immediately from the first HBOT session, the mitochondria can run more efficiently and produce more ATP in the face of more oxygen. If the oxygen exposures continue over the course of 10 to 15 sessions, the mitochondria will grow in size to further meet the oxygen supply. If the exposures continue 20 sessions or more, the mitochondria will replicate and divide, producing more mitochondrial density in all of our different cells and organ tissues. This begs the question, will hyperbaric oxygen therapy play a role in prolonging human lifespan and health span? Open question. I'm not sure, but my suspicion is yes. This gets back to one of the things I've seen, at least anecdotally, which is that people who dive, and diving mimics much of the physiology of HBOT, albeit in a lower intensity, let's say, they tend to be very healthy people. And there's a lot of reasons for that. And there's a lot of benefits to diving. It's one of the reasons that it's my favorite hobby, actually. Okay. So, anti-inflammatory effects. One of the cool things about HBOT is that it can improve the balance between cytokines. You've probably heard of cytokines. They've gotten a lot of press in the last 2 years for a variety of reasons, but cytokines govern your immune response. And so when cytokines are imbalanced, you can get a really wide variety of disease states. And what can happen in our modern world with all the weird stuff that's going on is that the body can get into this rut of producing one kind of immune response. And this is how you get these kids who are allergic to everything. It's how you get these people who have autoimmune diseases where their body's attacking their liver and their thyroid and their adrenal glands. And it's just like there's something wrong with them. It's a loss of immunological control due to an imbalance in cytokines. The literature on HBOT in modulating the immune response is not there for me to tell you that you can use it to biohack your insert autoimmune or allergic disease here. Do I think it could play a role? Sure, I do. I think oxygen and hyperbarics or even ozone in certain areas where there's a lot of inflammation, I know that I've seen and heard of cases where there was a really powerful benefit. But I like to do that in a strategic way, really taking into account the whole case. POTS is a long story. So that's postural orthostatic tachycardia syndrome. POTS is so much more complicated when it comes down to it than a lot of people want to know. So I won't address that question in too much more detail. All right. Hyperbaric oxygen therapy has a nice effect as well as an antimicrobial. A lot of people who are sick have got chronic infections within their body somewhere. And when you increase the oxygen tension, not only are you fueling the immune system, but the oxygen itself is going to be toxic to the obligate anaerobes. That alone can give you a nice therapeutic benefit or result. If I ever have an abscess, if I ever have some kind of infection, some kind of deep space in my body, I will be looking at my local hyperbaric oxygen therapy treatment center, and I will be getting them for cash if my insurance, if I have it anyway. I still have a healthcare sharing ministry because I never use it because I just pay everything out of pocket. I would make that a part of the treatment protocol for somebody with a deep tissue infection like that. which you would think would only happen to people who are living a really unhealthy lifestyle. I've seen it happen to some very healthy people out of the blue. Who knows why? All right, neurological conditions. This is one of the things that I think most people are going to be most interested in. With most neurological conditions, there is some type of injury or damage to the area of the brain and the circulation delivering oxygen to that area. As a result of damaged tissue and circulation, there is a massive reduction in oxygen getting to that area of the brain. A stroke would be a good example of this. So in a stroke, there's two types: there's ischemic and there's hemorrhagic. In ischemic, you wind up with a blockage in the artery. With hemorrhagic, the vessel wall breaks, and then basically that pocket of blood starts to accumulate and there's a lack of flow past it. Either way, there's a drop in oxygen delivery to parts of the brain, as well as with a bleed, there's actually a mass effect. This pool of blood starts to expand and it can damage and irritate the surrounding tissues. When that's resolved after the stroke, the body's got to resorb any kind of damage. And what will end up happening is it will lay down a certain amount of fibrosis. That fibrosis and fibrous tissue is not good because it's not easy for oxygen to get through it. So any nerves that are on the other side of that fibrotic tissue is going to, almost by definition, have a lower oxygen tension pretty much no matter what you do. That's where using hyperbaric oxygen therapy could be really helpful for these people. And, I haven't had the opportunity, but if somebody comes to me and they've had a stroke and they're struggling with residual issues and they're otherwise healthy and able to withstand hyperbaric oxygen therapy, I would strongly consider referring them for it for that reason. Same thing goes for somebody who's had heart attacks. It's a very similar pathology in the heart. But again, I take that on a case-by-case basis. So don't just take that as carte blanche. Just go out and treat everybody with this stuff. All right. One of the things about that is that when we lose circulation or a proper blood flow to an area of our brain, that area becomes dormant. And with that, and that's why you get these residual deficits for people with strokes and things like that, or residual deficits for people who've had heart attacks. A part of their heart won't contract properly. There's a hope that if you introduce more oxygen, neovascularization, improve blood flow, you may be able to wake those dormant areas up. We certainly see that on echocardiograms in patients who've had remote heart attacks. If they follow the proper diet and they get exercise and they're responsible, they can actually see their myocardium come back online and their ejection fraction normalize. It's one of the reasons why it's so important for these people to really take their diet lifestyle seriously. Okay. Jason includes some interesting thoughts here on the microbiome, and he makes an argument that the hyperbaric oxygen therapy can really improve your microbiome. I think that's a totally reasonable theory. Where this takes me in my practice is people with things like IBS, people with diseases like IBD. I've never heard or seen any kind of literature on this in inflammatory bowel disease. That would be Crohn's and ulcerative colitis. I would not be surprised if it worked in those conditions. But again, it might even vary on a case-by-case basis. What I do think it might be able to help is people with things like IBS. But IBS is treated so easily with so many other different methods, restriction diets, the proper supplements, the right herbs, other various dietary modifications, changing the way you cook, changing the ingredients, so on and so forth, that I'm not really reaching for something like hyperbaric to treat something like IBS. But if I had somebody who had a really resistant case, it would be one of the things I would consider telling them to at least try, because what's the worst thing that could happen? All right. Cancer. Cancer is such a hot button topic. It always is, always will be. One of the things you see in the cancer literature, going way, way back to Otto Warburg, is that hypoxia is one of the conditions in the cancer cell. In one of the recent papers I was reading about this by actually this guy, Brian Peskin, he notes that in Warburg's original papers, the oxygen tensions in the cell drop by about 35% in order to initiate the transformation into a cancer. So it stands to reason then that perhaps if you were to restore normal oxygenation of the cell, you could get the cancer cell to apoptose. That indeed is one of the ways that you get cancer cells to destroy themselves, i.e. oxidative stress. So if you increase oxygen tensions in the body, will you then kill microcancers? I think that's a really interesting theory. It goes back to other questions that I have, having read the literature about, do fevers prevent things like cancers? If you look at the incidence of melanoma in people who've had a fever, it's much, much lower. People who don't get fevers tend to get more melanomas. And the theory there is that when you're having this febrile episode, the heat and the increased blood flow to the skin, your immune system is triggered, and it actually attacks some small, micro cancers, tiny little cancer cells or tiny pockets of cancer cells, and takes care of them before they turn into a full-blown tumor. But anyway, I've also seen literature saying that, fevers are associated with more cancers. So it's a longer, more complicated story than that I haven't really had time to get to the bottom of. In any event, one of the concerns too, though, is that the oxygen levels may actually feed cancers. What Jason writes here is very important. As it turns out, higher oxygen levels in the body do not help feed cancer cells the way they do for normal healthy cells. Quite the opposite. High oxygen levels help to control and kill cancer cells. That does not mean that HBOT is being routinely performed or recommended for cancer patients. If I were a cancer patient and I was seeing a regular oncologist, I would ask them about it. And if I were a cancer patient, I didn't have an oncologist because I'd either failed therapy or I didn't like the oncologist or just decided I wanted to go all natural, I would talk to my integrative doc about hyperbaric oxygen therapy, because there are people who are doing this out there, particularly in the naturopathic world. All right. Jason talks a little bit about autism spectrum disorder. And the real thing to think about there is just autism is this disorder. Neuroinflammatory is often how it's described. When you increase oxygen delivery to the brain, you improve blood flow, you can have a radical impact on the amount of inflammation and help to resolve some of that chronic inflammation. So one of the things that I would, consider if somebody came to me with an autistic patient and asked me for a recommendation of what other integrative therapies could I do for this person, hyperbaric oxygen therapy would be on the list. It would not be first, though, because there's so many other things these kids can do. Simple supplement regimens, simple dietary changes, simple lifestyle changes, things like light therapy, getting more sun, that can have a really powerful impact before you jump to hyperbaric oxygen. All right. Next up, there's a lot of misconceptions about hyperbaric oxygen therapy. And myth number one, hyperbaric oxygen is inherently dangerous. That's just not true. I've never seen anyone suffer an injury from hyperbaric oxygen therapy. I've never seen anyone's disease or illness get worse. Part of this is because hyperbaric oxygen therapy is kind of hard to get your hands on. And so if you're going to be presenting to a doctor who's got access to it, they're not going to recklessly prescribe it to you, and they are going to use it in a way where they've seen the track record with patients, or they're going to be gentle, hopefully, presumably, if it's something that they have never treated before with it. In general, it's very safe, and so there's no reason to be afraid of it. Myth number two, there's no research to support hyperbaric oxygen therapy for insert disease here. That's definitely not true. There's lots of different clinical entities that hyperbaric oxygen therapy has been substantiated to be useful for. The question is, where should we use it in our therapeutic order, so to speak? I don't pull the trigger on hyperbaric oxygen therapy right away unless there's an acute issue. Why? If someone's just had some kind of insult, TBI, stroke, heart attack, it's the kind of situation where I would go back to the literature. I would see if the papers on hyperbaric oxygen therapy that had a positive outcome applied to them, and then I'd have a long conversation with the patient. Is this right for you? Is it in your budget for your therapies? Do you have access to this in a way that's convenient? And then make your own decision about whether or not it's the thing you want to do next. Because there's so much else to do with any injury besides hyperbaric oxygen therapy. Because remember, the oxygen is only as good as the cellular machinery that it's then supplying with oxygen for oxidative phosphorylation and mitochondrial function. All right. But anyway, we do need more studies, but they're not doing studies quickly on hyperbaric oxygen therapy because guess what? No one's going to make a really enormous fortune off of it because it's really too effective, and the chambers are reusable. Drugs, surgeries, far more lucrative for the medical system, and therefore the thing that people, when I say people, I mean doctors, hospitals, etc., are gravitating towards. All right, myth number 3, hyperbaric therapy can cure everything. I mean, obviously that's not true, but is a useful adjunct for a lot of illnesses. Certainly most of the illnesses that I see as a general internist practicing natural and holistic medicine should respond in some number. I don't know if it's 20% of patients, 50%, 80%. And I don't know what the treatment dose required is. Is it 20 hours under pressure? Is it 30? Is it 10? I don't know. But I think most of the illnesses I see on a daily basis could be helped by hyperbaric oxygen therapy. That's something I'll be asking Jason when we jump on a live in about 10 minutes. He'll be joining me. So, frequently asked questions. What are the side effects and risks? There are three major risk concepts associated with HBOT, and I would be remiss not to discuss them in this book. I will say that a skilled technician in a clinic with proper education and protocols should be easily able to avoid these issues, but I will go over them nonetheless. I'm not going to go over them in detail. If you choose to pursue this, I recommend that you read a book like this, get some idea of what you're getting into. It really behooves you to understand the therapeutics that you're making use of, not to just run around in life trying the next thing, And when it comes to hyperbaric oxygen, the things that can happen that are adverse events are decompression, illness, or air embolism. None of these really happen when you do it properly. CNS oxygen toxicity, that really, you got to have a really heavy duty chamber and a long exposure to make that happen. And then pulmonary oxygen toxicity, again, not common. Otherwise, frankly, we really wouldn't be using this. You can get some issues with pressure injuries to your tympanic membrane, just like you would if you were diving. People need to be able to equalize in order to sustain or withstand hyperbaric oxygen therapy. If you don't know what that is, look up a free diving video on equalizing. Sinusotitis, you can get fluid in the ears, and you can possibly get some visual changes. Not frankly quite sure why the visual changes happen. It's probably some kind of restructuring or change that's going on in the eye itself. Next up, more is not better. A really important therapeutic principle for me to reiterate constantly. Many people come to me and they think, I have tried this in the past, it's worked, now I need more because it's not working as well as it did before. This means that you're running out of what I call therapeutic runway. I always view every therapy as something as a little bit like landing a plane. I want to get you on the therapy to get the plane to land and then stop. We stop the therapy at some point because we should be able to get you into a lifestyle, an environment, and on a diet that works for you so that you aren't constantly having to take supplements or, let alone pharmaceuticals or have surgeries or procedures. Now, could things like hyperbaric oxygen therapy be part of an overall longevity and wellness plan? Of course, but it needs to be considered in the broader context because if you go after things like HBOT before you fix something as simple and fundamental as, say, your magnesium level, then I think you're really not doing yourself any favors. And to go back to that point, more is not always better. It doesn't necessarily behoove you to do more and more and more and more hyperbaric oxygen therapy. One of my favorite questions to ask patients is, when they ask me, should I continue doing X or Y, or should I get more of X or Y or Z, is to say, did it help you? And they say no. And I say, did it improve any metric of your life? Did it improve your blood pressure, your pulse, your respiratory mechanics? Did it improve your high sensitivity CRP or your vitamin D level or whatever? If the answer is no, why are we using the therapy? And that's what I mean by therapeutic runway. It's how long, it's the time that you're going to use the therapy, and then you're going to discontinue it. Because anything used to excess will stop working. That's called tachyphylaxis. It's a very simple pharmacological concept that somehow it seems like the world of medicine ignores when it comes to long-term medications. All right. I think that about wraps it up. Really great book, really great overview of hyperbaric oxygen therapy. Again, I'm going to be jumping on a live with Jason in a minute here. I'm going to take a quick break. For those who are interested in the book club, there's a members only Q&A at 8:30, which is after the live stream of this, where I'll be going over questions behind the scenes that either patients or members of my paid Substack have asked me. It will be more the nitty gritty and how I use it in my clinical practice rather than the basic overview that I offer you guys here. So as always, thank you for watching. Take care. Have a great night. Don't forget to subscribe to my Substack. Make sure you're subscribed, liked, share, comment, all those good things on my social media. And I encourage you to apply for consultation at stillmanmd.com. To click on the right-hand corner and go to apply for consultation. As always, thanks everyone for watching, listening. Have a great night.